Palpation for the muscles of the shoulder complex. Just a reminder that the attachments, i.e. origins, insertions and actions for these muscles are available on several of the resources on the Moodle page, including your online delivery, which is released with the content of this module. So the first muscle on your palpation sheet for the shoulder is the trapezius, for which we have the upper, mid and lower fibers of trapezius. So these can be activated in three different ways. So for the upper fibers of trapezius, I'm going to place Barry into cervical extension. So one thing I'd like to do is lift your chin up towards the ceiling for me and go back as far as you can. And then resist back against my hand. So one hand is palpating for the upper fibers of trapezius, whilst the other hand is resisting just like any other muscle. For these mid fibers of trapezius, a good way to do that is just like you would in the gym with a shrug. So Barry, if I can ask you to shrug your shoulders upwards towards the ceiling, and then don't let me move you, so push up towards. So if you wanted to isolate the right hand side, you might just contract here laterally for the mid fibers of trapezius. Okay, for the lower fibers of trapezius, what you can ask your client to do is imagining that you're trying to tuck these scapulars downwards and inwards towards the other back pockets of your trousers. So lowering the shoulders down towards the floor and the scapulars inwards towards each other, as if you're trying to pinch my finger here. Perfect. And that would be for the lower fibers of trapezius. Again, the attachment sites are available on your Moodle page on the weekly tile, but roughly speaking, the trapezius goes from the occiput as the origin down towards roughly T12, and then attaches onto your humerus. It's like this diamond type shape muscle. The second muscle that we covered on your palpation sheet is actually deep to the trapezius, so it's more of a reference point rather than to palpate it. This attaches from the T1 down to T5, depending on whether you're on minor, which is higher, or major, which is lower and larger, hence the name major. But essentially these retract the scapulars, so they push the scapulars back towards each other. So if Barry imagined he was almost going to go into like a row position with the hands in front of him and then pushes back, that would activate rhomboids major and minor because that retracts the scapula. However, that is deep to trapezius, so we're not always going to be able to see that on most people. The second muscle, if I turn Barry towards the side to face the board just here, we've got latissimus dorsi. So latissimus dorsi is the largest muscle that we have in the body. To activate that, we need to place him into flexion and then get him to extend from that flex position. So if you think of like a lat pull down, that would activate the latissimus dorsi nicely. So Barry's going to place his hand just on my shoulder here and then push down to activate this latissimus dorsi muscle. So latissimus dorsi will extend you from a flexed position. So that activates it quite nicely, and hopefully laterally you can see that forms part of your armpit or the axilla laterally, and then medially, the medial part of your armpit is actually formed by pec major and minor. If you turn to face that way for me, please, Barry. Fantastic. So the latissimus dorsi attaches from the thoracolumbar fascia inferiorly, and then upwards towards about T7. So you're looking about in line with the inferior angle of the scapula, downwards from here and upwards towards the humerus. So that is your latissimus dorsi. Pectoralis major is another muscle, so if you turn all the way back towards me here, pectoralis major attaches from your sternum medially, the clavicle here, and then attaching onto the humerus in this direction. So what you could get your client to do is almost go into like a horizontal adduction position, which is like a prayer position, and then squeeze the hands together, and that's going to contract the pectoralis major muscle, which horizontally adducts the shoulder. Okay. On a female client, obviously we'd only palpate pec minor or superior fibers of the pec major itself, just by where the clavicle is here. So these are the attachment sites for pec major. Okay. Serratus anterior, you're going to get the client into almost like a jabbing position. So this attaches from the medial border of the scapula on towards the ribs anteriorly. So if you turn to face the board just here again for me, get your client into like almost like a jabbing motion, but not pressing too hard forward like a jab, and then pushing forward here and resisting horizontal adduction again. So medial border of the scapula attaching on towards the ribs here is where you see serratus anterior, so in between each of these costals. The next muscle on your palpation sheet is the deltoid. So the deltoid attaches from the lateral aspect of your clavicle round towards the acromion and then posteriorly towards the spine of scapula as well. So it almost forms like a crescent shape, like a C shape around the shoulder region here laterally. So we've got the anterior fibres from the lateral clavicle and the acromion, the lateral fibres from the acromion and posteriorly towards the spine of scapula as well. So this is the best position to view it in. So what I would do for the deltoids as I get them to bring that arm up towards the side into abduction with a flexed elbow. For the anterior fibres, the best way to view this would be firstly to palpate the anterior fibres, and again he's going to jab forwards towards me because the anterior fibres help to flex the shoulder. For the lateral fibres, I'm now going to palpate just lateral to the acromion, and he's going to push up into abduction, lifting his arm up towards the ceiling. And then the posterior fibres, he's going to go into almost like a row. So imagine he's got a cable in front of him. He's going to try and push back because the posterior fibres, all of which these fibres attach onto the deltoid tuberosity. So pushing back towards me, I palpate with one hand, and then he pushes back with the other. And that's the deltoid anterior, middle and posterior fibres, all attaching, as I say, onto the deltoid tuberosity of the humerus. Biceps brachii is obviously best viewed from an anterior perspective, so the long head and the short heads. We've got the short head attaching onto the coracoid process, the long head attaching on the glenoid tubercle of the glenoid fossa. So they're the attachment sites for the two heads of your biceps. We've already palpated the between the tubercles. So we've got the long head of biceps attaching up here between your lesser and greater tuberosities at the intertubercular groove. So attaching onto here via the intertubercular groove downwards onto the radial tuberosity. That's where both attach. So simply, we're just going to place Barry into elbow flexion here. You can supinate as well, so you can bring him into an element of supination to bring a further contraction. But for now, purposes today, we're just going to get Barry into elbow flexion, push upwards towards the ceiling for me, and you're going to palpate from the radial tuberosity, which you'll learn as part of the elbow bony landmarks, long head and short head upwards towards the shoulder region, and that is the biceps brachii. For the triceps brachii, it's best placed in the opposite direction. You can have the patient lying on a prone position and elbow extending, but for the purposes of this, we've got three heads for the triceps. So you've got a long head, a lateral head, and a medial head. The long head attaches on the glenoid tubercle again and the glenoid fossa, but the other two attach onto the humerus. Inferiorly, these all attach along to the olecranon process, which is part of your ulna. Okay, so roughly speaking, posterior on the humerus, that's where you're going to find these muscles. So what we can do is we can extend him from a flexed position. So if you bring your palms up towards the ceiling, and then from here, just lower yourself down slightly, and then extend back towards me. We can palpate just inferior to the deltoid, feeling for the long head, lateral head, and the medial head here, palpating with one hand, and then the other hand is resisting onto that olecranon process where we have the merging tendons of the triceps brachii. Next muscle on your palpation sheet is the supraspinatus. So the supraspinatus attaches from the supraspinous fossa and attaches onto the greater tuberosity of the humerus. So with the supraspinatus itself, just bear in mind it's deep to the trapezius, so we can't actually palpate it too well. So if you find the spine of scapula to begin with, above that, superior to that in terms of bony landmarks, would be where the supraspinous fossa is. So that's where you're trying to palpate in. What we're trying to do here is activate the supraspinatus without activating the upper fibers of trapezius, which are above it. Okay, so they're superficial to the supraspinatus. So with Barry's hand out in front of him, elbow tucked in, we're going to get him to abduct towards the ceiling, so bring the arm up towards the ceiling in this direction. So fingers are above spine of scapula where the supraspinous fossa is, and then he's going to push upwards towards the ceiling. So if there's any muscle that activates there, we're abducting, so the upper fibers of trapezius shouldn't contract, but you should feel the supraspinatus underneath your fingertips. So that's the first one. supraspinous fossa towards the greater tuberosity of the humerus, and that abducts the shoulder. The next is infraspinatus, which attaches from the infraspinous fossa. So you can palpate the medial border of the scapula, inferior angle, lateral border of the scapula. All of that triangle here, before you get to the spinal scapula, is the infraspinatus muscle. So in that space is where infraspinatus is. So you can palpate here, and rather than abducting towards the ceiling like this, Barry's now going to externally rotate. So as if he's trying to shake someone's hand and then bring the hand out away from him. So if you can go into that position for me, and then go back into neutral, and I'm going to palpate where I need to for supraspinatus, so for infraspinatus. Keep your elbow tucked in and try and push outwards towards me. That should activate infraspinatus. So the movement that Barry is resisting is outwards towards me here, keeping the elbow tucked in. So that's infraspinous fossa towards the greater tuberosity of the humerus. External rotation does that. Okay, we can also do similar with teres minor, so that would also externally rotate the humerus. For teres major, we're going to get him into the hand, into the belly button. So that's him resisting internal rotation on himself. So he's going to bring the hand in towards the belly and then push in that hand towards the belly button. And then as he does that, if you relax, just underneath the scapula here, we might feel teres major, push in, and you should feel the activation of teres major just in here. So that's 3 of your rotator cuff muscles. Remember, it's the 6 muscles, so supraspinatus, infraspinatus, teres minor. Subscapularis we cannot palpate because it's an anterior muscle on the rotator cuffs. There's too many structures in the way to be able to palpate it. The last thing we're going to palpate as part of this on your palpation sheet is the thoracic spine region of the erector spinae. So remember, we've already covered other aspects of the erector spinae, but what we'll do is we'll get Barry to cross his arms over his chest and then reference him to the sternum, so where the kind of chest bone is, the sternum, and we're trying to bring that sternum upwards towards the ceiling as far as you can. That is then going to extend the thoracic spine and therefore activate the group of erector spinal muscles, which are your erector spinae. And that concludes palpation of the muscles for the shoulder.